Hello and good afternoon. My name is Catherine Hammond. I am presenting today on a fictional diabetic prevention program that is specifically geared towards military health. So, of all the research that has been provided through these 10 weeks, I've decided that a digital diabetic prevention program would be the best option for the target population. Normally, the Veteran Affairs provides the data, and that's a little skewed because younger members of the military are also experiencing chronic illness and type 2 diabetes. They are going in healthy but coming out unhealthy. So that's an issue that we'll need to work on. Type 2 diabetes is well studied within military health, but is not considered a priority within the Department of Defense. It is something that a lot of Americans experience. It's common, it's prevalent, and for lack of a better word, spreading. So it's not being managed very well, and it is affecting military health as well as everyday American life. According to the CDC, there are 6 areas of social determinants of health, and this is going to look a little bit different considering that the military lifestyle is very different than an American civilian lifestyle. So even if we're looking at interpersonal, intrapersonal, organizational, community, physical environment, and policy, many of those are already taken care of because it's under the Department of Defense and government. So this is why we're going to look at more self-motivation tactics and looking at making a chronic illness and prevention for diabetic issues as a intrinsic value to hopefully motivate Americans and both military health. A closer look at social determinants of health show that there is a lack of data on young military members. The Veteran Affairs focuses on older generations of retired military members, and that may mean that the data is skewed. The sad truth is that many younger military members in the age 30 group are developing prediabetes, if not type 2 diabetes, and it's also a issue with Americans overall. There are currently ongoing studies through the military consortium, but again, that data is limited. And we know that many of the issues, such as environmental, physical, a lot of those are taken care of because they're within an organization. So they do have access to healthcare. They do have access to living on base. So some of the issues that we really need to focus on are data, like what is the issue? We got to look at motivation, self-efficacy, and we have to look at how we can actually educate the population and motivate them to see this as an intrinsic value and of national security. So again, the biggest challenge is that there's a data gap. So it seems like we're taking care of it through the Veteran Affairs, but there should be some more extensive studies to see how this is affecting younger military members, and also as a way of cost effectiveness of if we prevent it now, we're not paying for it 50 years later through veteran services. So again, data is a challenge. If we don't know what we have, it's hard to find a solution. So we currently have the Millennium Cohort Study, which is a DoD research project. And again, that's the Department of Defense, whereas a lot of our data is pulled from Veteran Affairs. So the Veteran Affairs is going to be a lot older. But DoD and VA are working together to say, yes, we've had these wars. Yes, we've noticed that military members have certain chronic illnesses afterwards. And so that has to be studied a little bit more before we can actually implement really effective prevention programs, maybe even during battle or post deployment or even as a veteran. So again, in a lot of bridging the gap for data, their risk factors for military is going to look a little bit different than the average civilian. So we noticed, like, for example, in the Gulf War, many were coming home with PTSD. We noticed that in Vietnam, those who were exposed to Agent Orange had higher risk of type 2 diabetes. And many studies also indicate that PTSD is a precursor to other chronic illnesses. So we know that there are wars, there are battles, and if we are not implementing preventative care beforehand, before it gets too bad, then it could be a problem. So for military in particular, they could be exposed to chemicals. They are in a population that has increased diabetic issues later on in life due to stress. And there's also many mental health issues within the military later on from traumatic, either physical or mental situations. So this is where self-determining theory comes in for a digital diabetic prevention program. So diabetic prevention programs are pretty common, but to incorporate technology as well as a self-motivating theory would be a way to have autonomy, competency, and relatedness because it can be used as a social networking app. It can help to educate. We could use military health documents about diabetes as well as exercises. And the participant can do it on their own and their own way that they want to, either participating in the tracking or trying to use a diabetic cookbook. There's many ways that they could use it to their benefit. So how does culture play into the military and organizational efforts? The military does have its own sort of organizational hierarchy and structure, but even within that, there are subcultures or co-cultures, such as, like, for example, Navy SEAL or Airborne Ranger. They all have their sort of niche, and all of them have to maintain a certain type of ethical behavior and follow organizational hierarchy patterns. So in that way that they're connected, even though they might be from various different backgrounds or demographics. At the moment, recruitment is low. According to the 2022 demographics for Military One Source, there is about 70% of the military are Caucasian males who are Christian. So that is a huge chunk. And although military is more diverse than usual, it's also, something to take into consideration. So we've established the demographics and cultural influences, but as you can see here, all of these many military members, well, this one here is for Air Force, but we'll say Air Force members from different parts of the United States with different backgrounds and different demographics. You can see here that their glucose levels do change. Not significantly, but they do change, and that could be a precursor to maybe chronic illnesses or trying to prevent diabetes later on in life. But again, with these younger military members, we need to conduct more studies. So what should military leadership do? The military health community should be looking at ways to make it accessible, equitable, pulling resources from all the organizations and putting it in one place where an individual can autonomously access all of that. So what would a digital DPP look like that's developed by the military leadership to enforce SDT? That would be social networking. Hopefully we can incorporate artificial intelligence, definitely a tracker for glucose, food, your mood, like a mood journal, also access to exercise videos, and also implementing science-based methods. So we're not just making something up and putting it on an app that's pulled from YouTube. These are from military documentations that have been tested and tried. And again, something to include maybe on the homepage is maybe a quick informational video or some sort of motivational inspiration or fact, such as 45 minutes of walking a day at 3 miles per hour could reduce your risk of type 2 diabetes. That type of information could be important for the person to know, or to at least attempt to try to take care of their health. So most likely in the future, digital diabetic prevention programs and many apps will include artificial intelligence, and that'll sort of bridge the gap between having health professionals. So you could train an AI bot specifically on diabetic needs, and you could have that be a way to either look at the data, the tracking data that's being implemented, and then have suggestions like a doctor would, or you could ask it a question and the database that's in the AI could answer that question. So having this unique app that could have a tracking device, AI, a cookbook, exercises, like all in one place, and could be user friendly and maybe adaptable and individualized per person. So this would be a very unique product using evidence-based research, and is definitely a piece of technology from the future. I imagine within the next 10 years, many people will be developing apps like this, if not just for DPP, but in general. So in conclusion, a free DPP that is available to military and later on civilians would be an effective way to reach a large population over different cultural differences and demographics, but still using methods that would make it autonomous and motivating and incorporate education so that the individual can help themselves. I think this is a very good solution, and I highly recommend this for military health leadership. Thank you very much for listening to my presentation here. This is a 10-week course on health that I've taken, and so I've extensively done some research over the last 10 weeks, but I am by no means an expert. So I'd be really willing to hear any feedback that you have, or anything that you have to improve upon the information that I currently have. You can email me or reach me at my portfolio. Again, thank you for your time and have a good day.